Hi, I am Dr. Dasmit Singh, speaking from Jehangir Hospital. I am a pediatric surgeon. The most often question which people ask when they ring up for an appointment is that is it safe to attend your OPD in a hospital? So my answer to that is just wear the mask. Let your child also wear the mask and you can safely attend the hospital. There is absolutely no data to show that just attending the hospital or coming to the OPD has increased the chances of COVID. So it's quite safe. Then when it comes to surgeries in children in the COVID era, so two places where we are really finding difficulty is a patient who's been waiting to get some routine surgery done and suddenly lands up with a complication because they've just gone on postponing the surgery, that wait for the COVID wave to go down and then we'll go ahead and do the surgery. I think that approach is not quite appropriate, especially since we've seen that it's absolutely safe to operate on children. As a routine, all the children are monitored. We monitor them for about a week, also do an RT-PCR within 72 hours of the actual surgery and then go ahead with the surgery. Most of the hospitals now have such a beautiful way of segregating the COVID and the non-COVID patients. There is absolutely no exposure that the child will face or the parents will face when they come to the hospital for COVID surgery. So it's absolutely safe to go ahead and do conservative line of management as well as attending OPD as well as going ahead with surgery if the need so arises. Supposing the child has some complication which has arisen out of the child developing a COVID infection. In that case, supposing surgery is necessary, let's say a patient presents with pain in abdomen and the ultrasound shows that it is likely to be an appendicular inflammation. Now, should we be operating on that patient or not? That is the prime question which everybody has to think about. Most of the time we are able to conserve these patients. There are very specific criteria where if the patient cannot be conserved means non-operative management. If the patient cannot be conserved, then we go ahead and operate. And again, all kinds of precautions have to be taken, both within the operation theatre and for the healthcare professionals who are involved with the surgery of the child. So the parents, when they are kept along with the child, the parents have to be using N95 mask because now they are in a positive environment with the child. In the operation theatre, all of us are wearing proper PPEs, we are wearing our masks, we are wearing our goggles. It is always very difficult to operate in such trying circumstances, but you need very good air conditioning which will help the environment to be adequately geared up for operating on a positive patient. Surgery wise, there is no difference. Healing wise, yes, because of the COVID situation within the body, the immune response, the healing can get prolonged or delayed. At least we anticipate that. Take adequate precautions, and but in our experience what we have seen is that there is not much of a difference between operating on a non-COVID child and a child with COVID complication. This is especially true because the children have a very good immunogenicity. Their ability to heal the wounds is far better than what adults have, and COVID bhi hamara kya bigaad lega. That is the kind of situation which we face in children. So there's absolutely nothing to worry about. If your child needs surgery and we are forced to do it, we will do it even in a COVID situation. As far as routine surgery is concerned, absolutely nothing to worry about. Please go ahead, take your appointments and go ahead with surgery. Make sure it is done in a place which is adequately geared up for COVID positive patients. Thank you.